Public health is the science of improving and protecting the health of communities and families through promotions of healthy lifestyles, research for injury and disease prevention, and control and detection of infectious disease. Overall, public health has a main focus, and that main focus is the concern to protect the health in the entire population. That can mean vaccinating children and adults to prevent the spread of disease or educating people about the risk of alcohol and tobacco. Public health professionals try to prevent problems from happening or recurring through implementing educational programs, recommending policies, administering services, and conducting research. 4 important topics that fall under public health are gun violence, chronic diseases, vaccination, and high school graduation.
Hello everyone, my name is Christia Malanga and I'm going to be talking about gun violence and mental illness. Gun violence and mental illness is the #1 public health problem, especially in the United States. Guns kill approximately 33,000 Americans and injure 80,000 a year. Links between mental illness and gun violence are similarly continuous among researchers who study these trends. Several studies suggest that subgroups of persons with severe or untreated mental illness might be at an increased risk for violence in periods surrounding psychiatric episodes or psychiatric hospitalizations. Gun violence is violence committed with the use of gun, firearm, or small arm. Criminal gun violence includes homicide, assault with a deadly weapon, suicide, and attempted suicide. Gun violence is an important national problem, leading to more than 31,000 deaths and 78 non-fatal injuries every year. According to recent studies, the United States still remains substantially higher when it comes to gun violence. There are so many people killed by guns in the United States each year, to the point where the CDC has decided in calling gun violence a disease that should be studied and that is definitely worthy of studying. Gun violence statistics. There are 1 in 3 people in the U.S. that know someone who has been shot. On average, 31 Americans are murdered with guns every day, and 151 are treated for a gun assault in an emergency room. Over 46 people are shot with an accident involving a gun. A gun in the home is 22 times more likely to be used to kill in a homicide rather than a suicide. And located here is just a chart of 8 countries with the statistics of gun violence. And as you can see, the United States is higher compared to all the other countries. More than 1 in 5 U.S. teenagers ages 14 to 17 report having witnessed a shooting. And in 2007, more preschool-aged children were killed by guns than police officers were killed in the line of duty. And here's just a picture that states that every day 8 American children are killed by guns. Gun violence is a drain on U.S. taxpayers. Medical treatment, criminal justice proceedings, new security precautions, and reductions in quality of life are estimated to cost U.S. citizens about $100 billion annually. The lifetime medical cost for all gun violence victims in the United States is estimated at $2.3 billion, with almost half of the cost borne by taxpayers. Mental illness. Mental illness refers to a wide range of mental health conditions, disorders that affect your mood, thinking, and behavior, and examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors. And here's a list of mental illness symptoms, and some of them include feeling sad or down, alcohol or drug abuse, and major changes in eating habits. Assumptions on mental illness and gun violence. The focus on mental illness is the wake of recent mass shootings reflects decades and long history of more general debates in psychiatry and law about guns, gun violence, and mental competence. Psychiatric articles in the 1960s deliberated ways to assess whether mental patients were of sound mind enough to possess a firearm. Database that track gun homicides, such as the National Center of Health Statistics, similarly show that fewer than 5% of 120,000 gun-related killings in the U.S. between 2001 and 2010 were perpetrated by people diagnosed with mental illness. And in the United States, political and popular discourse frequently focus on the causal impact of mental illness. Thoughts about gun violence. Gun violence is a major public health problem that kills 90 Americans a day, according to Dr. Alice Shen, which is Executive Director of Doctors for America. On public health matters, it's critical we listen to doctors, not politicians. You might ask why. Well, every day, 89 people die because of gun violence, and we cannot let politics get in the way in the response of this epidemic. And that's why it's essential to remove these obstacles and pass a bill to find more funding for public health research on gun violence. Evidence shows restricting individuals' access to firearms at times of increased risk of suicide and violence. Whether they have mental illness or not, they can decrease rates of suicide and homicides. In conclusion, scapegoating those with mental illnesses after tragic instances of gun violence is not making our population, nor is it promoting mental health.
Hi, my name is Katie Shaw, and I'm going to be talking about chronic diseases and public health. Nearly $500 billion is spent on healthcare costs due to chronic diseases each year. 70% of deaths among Americans each year are from chronic diseases. Heart disease, cancer, and stroke account for more than 50% of annual deaths. And nearly 58 million people are exposed to secondhand smoke, which is linked to heart disease and cancer. Hypertension or high blood pressure is a condition in which the force of blood against the artery walls is too high. 1 in 3 adults in the U.S. have hypertension or high blood pressure. Nearly 70% of the first heart attack and 77% of the first stroke is in adults with hypertension. According to the CDC, reducing your daily sodium intake by about 1,000 milligrams a day can reduce high blood pressure by 11 million cases a year and save up to $18 billion in healthcare costs per year. Cancer is a disease in which abnormal cells divide uncontrollably and destroy body tissue. There are more than 100 types of cancer, and any part of the body can be affected. Tobacco use is the single largest preventable cause of cancer in the world, and it causes 22% of cancer. More than 30% of cancer could be prevented by not using tobacco, being physically active, and moderating the use of alcohol. Chronic obstructive pulmonary disease, or COPD, is a group of lung diseases that block airflow and make it difficult to breathe. It is commonly misdiagnosed as asthma, but COPD is actually much more serious. About 13 million adults have been diagnosed with COPD, and an equal amount remain undiagnosed. The damage to the lung tissue cannot be reversed, but it is possible to slow down the destruction and manage the disease. COPD affects both children and adults. Diabetes is a disease that evolves from too much sugar in the blood, or high blood glucose. The most common types of diabetes include type 1 diabetes, when the pancreas produces little or no insulin, type 2 diabetes, in which the body has difficulty processing blood sugar, pre-diabetes, in which the blood sugar is high but not quite high enough to be classified as type 2 diabetes, and then gestational diabetes, which only affects pregnant women. Diabetes is the leading cause of kidney failure, non-injury lower limb amputations, and blindness from adults aged 20 to 74. Nearly 26 million children and adults in the U.S. suffer from diabetes. Medical expenses for diabetics is nearly 3 times as high as medical expenses for people without diabetes. So how can we change this? We can increase availability and improve access to supermarkets and incentivize healthier food and healthier beverage options. We can increase access to outdoor recreational facilities and promote physical activity. And we can support the federal programs such as Partnerships to Improve Community Health, the National Diabetes Prevention Program, and the Plan for Health Project.
Hi, my name is Yvonne Lung, and I will be talking about the importance of vaccines. Vaccination is an important topic within public health, so I'll be talking about that today. So what is a vaccine? A vaccine is a biological preparation that improves immunity to a particular disease. It contains parts of a microbe or a whole weakened or killed microorganisms. These organisms are injected into the body, which allows the body to protect itself and increase the immune system. And if the disease were to occur, it would be able to defend itself. So why is vaccination important? Over the years, vaccinations have diminished the threat of infection. It also prevents diseases from occurring in the first place. In addition, it also decreases the risk of complications and risk of transmissions. But most importantly, vaccinations are a cheaper route versus treating the disease. So are vaccinations safe? There is a statistic that says that 1 out of 12,000 chances for you to be struck by lightning versus 1 out of a million chances of having a severe reaction to a vaccine. So to answer that question, yes, vaccines are safe. In fact, vaccines have a safety standard and requires many years before the vaccine is released to the public. The CDC states that the United States currently has the safest, most effective vaccine supply in history. Vaccinations have mild to no side effects, and if a side effect were to occur, it would just be a sore on the arm. However, over the years, vaccinations have become voluntary. There have been cases that normal children have been developed mental disorders due to vaccinations, and in fact, California and other states, parents were allowed to exempt their children from immunizations, and that the law states that there should be a balance between public health and parental choices. However, since these laws have passed, this has caused a measles epidemic. And in 2000, health officials reported that measles were eliminated, but in 2014, 644 cases were opened up, and in 2015, there were more than 100 measles cases that had occurred. However, after this measles epidemic, we're hoping that this encouraged policymakers to make more strict and strengthen the vaccine laws, and to also consider medical reasons as the only exemption for vaccinations. So vaccinations are important. Together, we must maintain the progress and effectiveness of vaccines, and that as a community, we should trust the science behind vaccinations since they do protect the community when it comes to diseases such as chickenpox or the flu. And most importantly, you should educate yourself and get vaccinated. So by educating yourself and getting vaccinated, we'll be able to protect ourselves and our loved ones, and most importantly, the community.
Hello, I'm Soumya and I'm presenting about dropout crisis, a public health problem and role of school-based health center. Education is the strongest predictor of long-term health, and individuals with lower income, lesser education and lower status occupations and employment have poorer health. Consequences of educational disparities are striking. Adults with less education, low educational attainment are more likely to die of cardiovascular diseases, cancer, lung diseases, and diabetes. Consistent to these findings, it has been noted that high school dropouts are likely to have health insurance coverage than college graduates, and 40% of dropouts are uninsured, thus perpetuating a reliance of high income, high expense, tax supported emergency care. There is an argument that public health is an issue of high school dropouts. 2008 estimate of dropouts cited by National Center of Educational Statistics indicates 8% of American high school students left school before they graduate. In 2004, locating a dropout crisis, nearly 80% of high school students with highest number of dropouts were found in just 15 states. Uninsured persons accounted for nearly 1/5 of 120 million hospital-based emergency department visits in 2006. This was a study from Nationwide Emergency Department sample. Policymakers have initiated the phenomena of high school dropouts is moral and economic imperative for the nation. System changes such as policymakers and educators have initiated system changes including improvements in school climate, cultural competence, and enhancement for curriculum and instruction have provided additional resources for both students and teachers at risk. As consequence, some progress has been made and dropout rates have decreased, but not enough. The potential cost of future health problems, lost tax revenues due to low earnings, and higher cost of imprisonment, welfare, and other transfer costs amount to over $25 lakh per youth who does not earn a high school diploma or a graduate. Most of the obstacles for dropping out were noticed as chronic diseases such as cancer, such as asthma, diabetes, tooth decay, substance abuse, and depression. Other social determinants such as health and well-being, like poverty, hunger, homelessness, violence, etc., were also contributed to the reasons for dropout. An estimated 12.8 million days of school were missed each year due to asthma alone, making it the leading cause for dropout. There are some details on welfare, taxes, crime, and healthcare. Coming to the role play. State-based health centers can readily address to both health dimensions of chronic absenteeism and dropout. Primary health factors that are attributable to dropouts as substance use, mental and emotional dysfunction. State-based health centers can provide mental health assessment and treatment in addition to drug counseling and treatment or referrals. The impact of these services have been shown to be stabilizing, have been shown to have a stabilizing effect in schools, such as 50% of the decrease in there was noticed as 50% of decrease in absenteeism and 20% of decrease in tardiness in students who received school-based health centers education, and evidence of high school students enrolled in school-based health centers. For girls, the leading cause for dropout has been noticed to be pregnancy. That is, about 30 to 40% of dropout students were pregnant. School-based health centers also have the capacity to benefit all students in school, addressing the barriers to learning, graduation, and such as school violence, hunger, and distress. School-based health centers gauge school-wide trends through developing and implementing the needs of assessment in student groups, teachers, and staff. SBHCs, that is the school-based health centers, are also recommend policies, processes with focus on target, multidimensional support to retain students, anti-bullying, discrimination, and improved access to healthy foods. Students who are engaged in supportive, motivating environment and who feel connected to their school will succeed. There is SBHCs, that is the school-based health centers, foster to positive, safety, and healthy learning environment that deinstitutionalizes dropout and instead focuses on graduation of all students. Thank you.
So with these 4 topics in mind, they focus on the health of the people and are issues that should be taken seriously in order to ensure a healthy community. Overall, these 4 topics in public health promote and protect the health of the people and prevent any more diagnoses, treatments, or procedures from occurring. By using scientific research, people in the health field can assure that the health of the people go first. In conclusion, public health works to track disease outbreaks, prevent injuries, and in countless ways make the world a better and healthier place.